Okay, so here we're looking at the male reproductive system. This is the penis, so this is the body or shaft and the glands of the penis, right? The testis is inside the scrotum, so the skin around is the scrotum. Then there are two testes, but we're looking at the one on the left side. So this is the testes, and here we have the epididymis, right? And then the epididymis connects to the ductus deferens, which is this tan white structure here that you see it coming up through the spermatic cord. Like this whole collection of structures is a spermatic cord. You've got to have a nerve, an artery, this venous plexus, so there's not just one vein, it's the whole plexus of veins there, and the ductus deferens also ascending in the spermatic cord. The muscle on the outside of the spermatic cord is the cremaster muscle. Remember, the cremaster muscle is a skeletal muscle, goes all the way down around the testes, and if it contracts, then that allows the testes to raise closer to the core body temperature. Right, the ductus deferens comes up through the inguinal canal, and then it's going to continue over here on the lateral edge of the bladder, which is this structure. So here's the bladder. So the ductus deferens continues here next to the ureter. Right, the ductus deferens then is going to pass onto the posterior side. It's going to be easier for us to see it once we take this piece out. So at this point you can see the bladder, the seminal vesicle, the prostate. Also you see part of the pelvic bone here. The pubic bone is over toward the front, right where the two halves of the pelvis come together at the symphysis pubis. The bone on the back side is the sacrum, and then that's connected to the coccygeal bone, or coccyx. Number 20 here is the rectum, which is going to continue to the anus, which is the opening for the digestive system. Let's see. If we look inside, you can also see the ureter coming down the inside of the wall of the pelvis. This muscle here, with fibers going transversely, is called the transversus abdominis. The major blood vessel here is the common iliac, which is then going to branch into the external iliac, which is going to go out to the leg, and the internal iliac, which is going to supply the inside structures of the pelvis. The bladder is also covered with a layer of peritoneum, so I think that they've labeled that as well. Now if we take this apart carefully somehow. Alright, so we're looking at the inside of the bladder here. Right, if we've taken this off, the ductus deferens has come to the backside of the bladder, and now it's continuing. Here is number 8. You see the ductus deferens, and it comes down into the prostate. So this structure is the prostate, and the duct, as it continues through the prostate, that's the ejaculatory duct. The ampulla is here, the last part of the ductus deferens. It's the ampulla that contracts to push sperm through the ejaculatory duct, and then it's going to go down here into the urethra. Remember, the urethra can carry urine from the bladder, or it can carry semen. Semen is the collection of the sperm plus the secretions from the prostate and the secretions from the seminal gland, which you see here, number 7. We don't see the duct that is bringing the seminal fluid, but it's going to be continuing there into the urethra. Right, then the urethra comes down, and it exits through the center of the penis. Remember, the penis has 3 columns of erectile tissue, so you have the corpora cavernosa, which is here, and then the urethra is coming out through the spongiosum. So there's 2 corpora cavernosa, 1 corpus spongiosa, that's here, number 10, and the urethra is passing here and then exiting through the tip of the penis.